Hello, and thank you to our friends at CSIS for this opportunity. I wish I could be there in person to tell you how much everyone at UNICEF appreciates your group's growing focus on immunization. That includes your white paper on how the U.S. can lead a new era of global immunization for all. Immunization is, by far, the best buy in public health. It dramatically reduces disease and mortality and the economic and human costs that go along with it. And it gives children a chance to grow up healthy, go to school, and reach their full potential. It's one of the most powerful tools we have to keep children healthy, alive, and thriving. But these benefits were not always being realized. Until the 1980s, eradication of diseases from vaccinations seemed a distant dream. Yes, vaccines existed, and we knew they were effective. But immunizing those pockets of unvaccinated children around the world required overcoming some significant barriers. The barriers of distance and geography, urban slums and remote rural villages, or communities in conflict, cultural barriers and barriers of acceptance, and the biggest barrier of all, securing political will and funding commitments to support our efforts. But thanks to a big global push and significant support and funding, including from the United States government and global partners, and many of you are in the room today, we managed to increase global coverage to 85%. A global victory. And today, every minute, every day, vaccines save the lives of at least 5 children. But over the last decade, our progress has stalled. In some places, we've gone backwards. Last year, 20 million infants, 1 in 10 globally, were not fully immunized because of poverty, conflict, distance, complacency, and increasingly, skepticism. In a digital world where rumors spread instantly, confidence in vaccines can plummet just as fast. Even here in the United States, we've seen measles outbreaks. And so, the time has come for another big push. We need a new approach to finish the job and increase coverage from 85% to 100%. UNICEF's Immunization Roadmap 2030 provides a new commitment to rally the world behind this important cause. We're combining UNICEF's long experience in delivering global immunizations with the work of our partners to develop new strategies to reach the unreached, those living in conflict settings, in rural and urban settings alike. And we're building a new information strategy to ensure that information about vaccines is easier to find than misinformation. Children's lives are at stake. We must join forces, including with social media companies and communities alike, to continue building trust in these medical miracles. A final point. As we increase coverage in communities, we also have an opportunity to make progress on strengthening overall health systems over the long term. We can use the networks and pathways for vaccine delivery to scale up other vital services like nutrition screening, maternal and newborn care, and adolescent health. All of the services children need to survive and thrive. The time has come for the next big push on immunization. I'm so glad that our partners at CSIS are standing with us in this battle. Let's ensure that every child, everywhere, gets the life-saving gift of a vaccination and a healthy future. Thank you.